Good afternoon, everybody. It is 2:15, our start time. So let's get right to it here. Thank you for those who have joined us we're on Facebook, we're on Channel 2, and for those media members who have joined in for questions, thank you. Our order today will be, again, my name is John Bernstrom. We will have Mayor Brown speak, then Dr. Deer from Ultra Health System has asked to say a few words. My understanding, Dr. Terry Brenner from the school district superintendent will say a few words, and then Mr. Weber, Brett Weber, city council member, who's been sitting in on the business listening sessions this week, will say a few words. There are obviously other people on the panel, as you can see. They're available for questions. After Mr. Weber's comments, we will open the floor up to questions to those in the media. Like we have done in the past, just raise your hand. I will get to you, open up your mic, and you can ask your question, and we'll go from there. We hope to have this wrapped up by about 3 o'clock. There are just other news conferences at the state and federal level that happen later on in the afternoon. So I'll do the best I can to give a warning of 1-2 questions left, please, and we'll go from there. But our goal is 3 o'clock. So we will get started here. We will start with Mayor Brown.
Well, good afternoon, and thank you for listening. As of this time, there has still been no confirmed cases of COVID-19 in Grand Forks County. It's evident the virus is spreading all across North Dakota, and as the state's third largest city, it's imperative we continue to be vigilant and cautious, stay the course with physical distancing. The health of our citizens is the #1 priority. We'll be talking today about a longer-term economic and social sustainability plan. That's important as we look at the overall well-being of the economy throughout and after this COVID pandemic. But I have to stress that priority remains community health and flattening the curve. The stronger we come out of the crisis from a health perspective, the better off we will be during the economic recovery. The economy will come back, our people won't. While staying at home, it's important to take care of our mental and physical health. I encourage everyone to get outside and go for a walk or run, exercise at home if possible. Read a book, play games, reach out to friends and family members by giving them a call or writing a letter. We're in this together, even if we are social distancing in our homes. While we have some free time on our hands, this is a good time to respond to the census. It should only take 5 minutes to complete. You should have received it in the mail, or you can fill it out at 2020census.gov. We'll be holding a special council meeting on Monday, March 30th, which can be viewed on GFTV2 and Facebook Live. The city continues to execute its mission. Flood action planning and execution is ongoing. Public works and waterworks operations continue. Police, fire, and PSAP continue to protect and serve our community. City Hall is closed to the public, but please contact our staff via email or phone and utilize our virtual City Hall at grandforksgov.com/virtual. I can't thank city staff enough for how quickly they've adapted to these changing circumstances. They are true public servants, and Grand Forks is blessed to have such a dedicated team. I appreciate how we're working with the council, especially coordinating with Council President Sandy as he helps facilitate their outreach efforts to ensure we're responsive to the citizens of Grand Forks. Governor Burgum has stressed an all of government, all of community approach, and that's no different in Grand Forks. Remember to support local. I've made a few executive orders this past week, and I appreciate the community continues to support local businesses. This week, community and business leaders held listening sessions for businesses in the effort to hear their specific concerns and issues and facilitate that information to our state and federal partners. They've been insightful and valuable feedback has been heard, and we look forward to hearing from the nonprofit sector this afternoon. I want to thank Council Member and Jobs Development Authority President Brett Weber for his engagement with our business community and leading these important discussions. We'll check with Dr. Weber today for an update on those listening sessions and how we're moving forward with economic and social sustainability planning. EDC President Keith Lund and Chamber President Barry Wilford are available today as well for any questions. First, we'll check in with Dr. Deer from Altru and Dr. Brenner from the school district. We are in good hands, but we need to do your job as to keep our community healthy. Complete your census, be cautious, be vigilant, and be North Dakota smart. Stay home and save lives. It's that simple. Thank you.
Thank you, Mayor Brown. We will go over now to Dr. Deer. Go ahead, Doctor.
All right. Thanks again for the opportunity for the updates from Altru. We continue to adjust our operations on a daily basis It's really been outstanding what we've been able to do as a health system and operationalizing a lot of changes over the last week to 2 weeks that are very patient-centered. We're focusing on video visits as a way to allow access for patients to continue to see us. We've discussed cares for the most vulnerable, and we'll be going to nursing homes, assisted living centers, and other places throughout the community to offer care there and limit people in and out in those facilities. We also continue to transition into a sick clinic, and more information on that can be found on our website, altru.org/coronavirus. Our testing continues to be quite brisk, and that our COVID hotline and our testing continues to be ongoing, and that's a 24/7 operation. We, like most other health systems across the country, are preparing to experience some financial challenges related to coronavirus. Our focus and decisions continue to be patient-centered. Every decision we're making isn't about finances. It's about what's best for our community and our patients. I just want to reassure everyone here that we're a community-based health system, and that's our focus. To date, Altru's completed 552 tests across our region. I know we like numbers. There's still no cases in Grand Forks, as Dr. Brown said. We do have cases all around us. There are 4 cases in our area, 3 in Ramsey County, 1 in Walsh. Another thing that's in the national news is the discussion on supplies. And we're managing this topic and supplies on a daily basis. We feel that we're managing appropriately and our staff are safe at this time. N95s, surgical masks, and testing swabs are those that are the most needed. We continue to work with the state and our suppliers on this, and we feel like we're in a good spot locally. Well, we want to thank our community for the outpouring of offerings to do and make masks. At this time, we cannot accept those. That's not to say that in the future we may not be on this type of forum asking that changes. As with everything of coronavirus, our stats and numbers that we give today, as well as some of the outlines from the North Dakota Department of Health, may change tomorrow. We just want to keep the community updated and informed at all times. And I thank the city for the opportunity to continue to speak on Altru's behalf.
Thank you, Dr. Deere. We will now go over to Dr. Terry Brenner from the Grand Forks School District. Dr. Brenner, please go ahead.
Thanks very much, John. Appreciate being here today and having a little bit of a platform to share what's been happening in our school district with the entire community. This week has been an incredible week because we have incredible educators across our 19 campuses. We put together a deployment plan to get student materials, student devices, student band and orchestra equipment, everything that had been left behind in schools. We put together a comprehensive plan specific to each building level to get those materials back into students' hands and back into homes by doing a curbside pickup. And so on Wednesday, we were able to accomplish that task with all of our elementary and middle schools. And on Thursday, yesterday, we completed that task at both of our high schools. And not only was it just a major feat to pull off, but some of our teachers and support staff were having a little bit of fun doing it as well. You probably see some videos going viral sometime either today or this weekend. So the important piece is we are ready to go with online learning on Wednesday, April 1st. The good news is many teachers have already started reaching out to their classes. They've built classroom lists. They have created classrooms through our Seesaw platform at the elementary level and through Google at the secondary level. And just back to the deployment of materials, our original plan was to get technology devices into the hands of all 3rd through 12th graders. And within 24 hours, we were able to turn that around based on the survey that we did with parents, assessing what their needs were at home. We were going to create a phase 2 to get technology devices into 2nd graders' hands in week 2 of this process. When all was said and done, every kindergarten through 12th grade student has access to a device. And for those people who don't have internet capabilities at home, we have purchased cell phones that have hotspots because just ordering a hotspot individually in and of itself, they're on back order by 3 or 4 weeks. So we're able to get the hotspots through phones, get those deployed to families. And by all accounts, some of the feedback that I've received, unsolicited feedback from parents who have sent me emails, everybody is pretty pleased with how the process is rolled. So that's probably the big news. The second part of the big news is Emily Carl, our Director of Child Nutrition, has been averaging 1,500 lunches, 1,500 breakfasts each day as parents have been swinging by to pick up food. So we're anticipating that that number will grow as long as we're out of session. But we are pleased to provide that service as well. And there have been a number of other community agencies who have stepped up to partner with us in meal deployment. So with that, I'm sure Joe Bowen is going to have some questions toward the end. So I will yield my time, the rest of my time, to those others who are on this call as well.
Thank you, Dr. Brenner. Appreciate that. And fourth on my list is an update from Councilmember Brett Weber on the work with the business listening sessions. Councilman Weber.
Thank you, John. First of all, we have some tough days ahead of us. It seems reasonable to expect, but it's impressive how all the good news and the way that our community has come together and the way that we are seemingly ahead of the curve already. This last week, the city and its partners, the Economic Development Corporation, the East Grand Forks Chamber of Commerce, and the Downtown Development Association held a series of listening sessions related to the COVID-related economic crisis. We tried to split these into significant economic sectors. On Monday, we heard from food-related businesses, grocery, and restaurants. On Tuesday, it was more of a retail focus. Wednesday was manufacturing, and yesterday we had a professional services listening session. Today at 3 o'clock, public is welcome to join a listening session from the nonprofit sector. These sessions have been joined by Mayor Brown, as well as special sector guests. On Tuesday, we had Paula Anderson from Sterling Carpet One. On Wednesday, with manufacturing, we were joined by Corey Melland of PS Industries and an EDC advisory board member. Yesterday, Sean Gaddy from AE2S Nexus and another EDC board member joined us. Additionally, we were very pleased and honored to have Courtney Jensen from the State Department of Commerce join us, as well as a variety of other community and state leaders. The purpose of these sessions was less about providing answers and more about listening to questions, challenges, and ideas. When it was possible, we answered questions and provided information, but mostly we tried to direct traffic. Our state and federal leaders are asking for this kind of information, and we've been moving that information forward. Locally, thanks to the mayor's leadership, the sessions have already resulted in policy shifts. Last night, I enjoyed a dinner of lavash, fried pickles, and I had a can of lager and a can of ale delivered from a local brewery. So these sessions are already resulting in some changes to keep our economic sector strong and alive. The session and the work that has ensued demonstrates both the collaborative nature of our community and its resilience. Grand Forks is able to deal with adversity, and just like the flood of '97, we will survive and thrive. When the worst of the current crisis is over, there are cities that will emerge as new leaders. Grand Forks is uniquely positioned to be among them, and the economic and social recovery plan that will guide us through that process is already developing. Now, with that said, if they're willing, I'd like to hand things over to my partners in this process, Keith Lund from the Economic Development Corporation and Barry Wolfert. Gentlemen, anything to add?
Let's go to Keith first.
All right. Thanks, Brett, and thanks for your leadership in hosting the listening sessions. I think you did a very nice job summarizing the conversations. A couple of things. First of all, obviously, we got a chance to provide the information that we learned, which is changing in a very dynamic situation. And I'm sure we all know that Congress just passed a $2 trillion economic recovery bill today. And we're going to be digging into that and trying to learn what that means for Grand Forks businesses. We communicated in these listening sessions primarily through a chat function, in which we were able to provide contact information and receive questions. But I was really impressed, and again, this speaks to the leadership of the community, that the feedback from the businesses that were attending was thankful that we were able to have these sessions and to hear their concerns and to host these. So we'll be hosting other ones, and Brett, will you be hosting other ones later on next week and presumably in the weeks to come? So I just really appreciate it. One thing I'd like to state, and I stated to area businesses, we're in an information gathering mode primarily. North Dakota Department of Commerce is going to be issuing a survey for state businesses coming out here. They said this week, it is Friday, so I hope it's today. They're trying to learn from North Dakota businesses what the needs are as they craft policy. State government is a very data-driven industry or data-driven organization, and so they're going to want to hear from businesses before they craft any kind of economic response for businesses. So I just encourage folks to look for that and to participate as quickly as they can. Again, thanks for the opportunity to be on this call today, and thanks for your leadership, Brett and Mayor Brown.
Mr. Wilford, do you have anything to add to that from the Chamber's point of view? Barry, your mic is still muted. We're getting you, Barry. There you are.
Just a couple points. First of all, I'm really proud of the Grand Forks, East Grand Forks business communities. They've been extremely innovative and creative and have already started to show some of their resilience. We've had a distillery convert their operations to making some of the solution for sanitary wipes. And I mean, I could go on. There's just a list of 20 or 30 encouraging stories like that I've heard. We also want to try to keep as much business going during this time that we possibly can. And a lot of businesses now have their hours posted at business hours at grandforksherald.com. That's where you send your hours, business hours at grandforksherald.com. We're trying to get the word out to people that you still can do business at a lot of businesses in our community. And then finally, we have a list of all the different resources for businesses at gochamber.org, which is the chamber website. Again, thank you guys for putting this together and putting the listening sessions together. We have a lot of positive things that we're going to be able to do, I think, in the next few weeks working together. And in the meantime, support your local business community.
Thank you, Barry. As I look across our panel, I will, unless I see a hand raised for anyone else looking to give some input, I will open this up to the media for questions. Please, members of the media, please use the hand raise function, just so I know to call on you and to unmute your mic. Please indicate to the best of your ability of who you'd like to answer. I realize some questions may have multiple people to answer it, but as I see, KNOX is joined us. Mr. Joe Bone from the Grand Forks Herald is joining us as well. Of course, we're streaming live on Facebook and on GFTV channel 2. So please use the hand raise function. We'll let it sit here just for a little bit while we have a hand raised from KNOX. I'm going to unmute you, KNOX. Go ahead.
All right, should be good to go here. I'll go ahead and get things started. So a question out for any of the three individuals that were talking about the business listening sessions, and you can decide which would be the best to take it on. So right now, the North Dakota legislature is not in session. They're not scheduled to come back into session until January, which would obviously follow elections and that type of thing. And yet we may need a response from them a little bit sooner. Has there been any indication from legislators? Have you had feedback with any of our area legislators about a state role or even possibly a special session to address some of those roles?
The Team Grand Forks approach to working with the legislature is a collaborative approach involving the city, county, chamber and EDC, the university, the airport authority, and that has been guided in many ways under the leadership of Barry from the chamber. So I'll let Barry take that question.
You know, I visited with several legislators this week. There isn't anything that I'm aware of in terms of actually the governor calling a special session. That certainly is an option. I think at this point, and I'm speculating here, Ryan, my guess is that, you know, we just had a $2 trillion, that's such a huge number, $2 trillion economic response and response to this virus passed at the federal level. And, you know, I think that's got to roll out here a little bit, and we've got to see what kind of impacts that have. And then I'm expecting that both locally and statewide, they'll look at what are some potential gaps that might still be there, and then take an appropriate response. And, you know, obviously the governor has the ability to call a special session if he feels one is needed to take appropriate action. But at this point, I'm not aware of any discussion to have a special session that I've been privy to at this point.
And Barry, I believe that the legislature at the end of their session, they reserved 3 or 4 days so they could come together under that allowance as well, right?
I believe that's correct, yes.
Any follow-up, Ryan?
No, I think that we can go ahead and wait for another day to talk about the legislature at this point.
I got you. Thank you, Ryan. Mr. Joe Bowen, go ahead.
Yeah, hey, I actually have a follow-up to Ryan's question. Regardless of whether or not you've heard about a special session maybe happening, maybe not, do any of you feel that one should happen? Do any of you feel that the governor should call a special session?
Anyone want to tackle this one?
I'm quite proud of the governor's leadership. I'm proud to be a North Dakotan at this time. We seem to be ahead of the curve on a lot of things. The governor and the mayor issuing emergency orders as they see fit to do so. And in fact, the state has, my understanding is there have already been adjustments to workers' compensation policy for first responders. I think that we're currently getting the kind of policy action, even nimbleness required at this time. But of course, it's a rapidly changing situation.
Exactly.
Agree.
Agree totally.
Okay, thank you, gentlemen. Looking for a hand raise from media members at all for a question. Mr. Joe Bowen, go ahead.
Hey, again, those 552 tests, I think I heard that right. Those were all completed since when? Like since what date?
And Mr. Josh Deere, Dr. Deere, did you hear that question?
Yeah, the 552 tests were as of this morning. That's from when we started screening for COVID period. We're awaiting results on 109 tests currently. We've done 487 tests in the Grand Forks and Greater Grand Forks area. Just to kind of expound on your testing question a little bit, earlier this week we did a Facebook facts discussion, and we just calculated our numbers versus the national numbers. The national numbers at the time of that, which obviously has changed to now, but they would be very similar. 9 people out of every 10,000 were tested nationally. North Dakota was actually second in the nation in testing, even though we weren't having community spread yet at that time. It was 19 out of every 10,000. And in Grand Forks, if you just took our local population, we were testing at 46 people out of every 10,000. So we're testing. I know that we don't have a positive yet, and I know that brings up worry that why not? But I think we can also look at that as a good thing, that we're accurately testing, we're doing what we should be doing, and when it's present, we should be finding it.
Thank you, Dr. Deere. Ryan at KNOX, go ahead.
For Dr. Brenner, so the governor making some announcements about at least some thoughts of using school buildings for some daycare facilities for those that would be lifeline workers. Where is Grand Forks schools in that? You may have already addressed it. If you did, I apologize. But if you could address if that looks like something that will be happening in Grand Forks, and perhaps how it will look if it's going to come here.
Dr. Brenner.
Thank you. We've talked about it internally. We haven't made any plans for that to happen. If the governor's proclamation becomes a little more of a directive, then we will respond to that directive. But it's our perspective at this time not to gather students in one place because they might be the most immune population, but some of the highest carriers. So right now it's just a wait and see approach.
Thank you, Dr. Brenner. Looking at the Grand Forks Herald or KNOX for a hand raise, Mr. Joe Bowen, go ahead.
So those 400, I think you said 487 tests and another 109 you're waiting on. What I'm asking is, since what date have those all been conducted?
Dr.
Yeah, we started our coronavirus hotline on the 13th. So it's been since the 13th. So it's been since the start that the state did the test, started doing the testing. I can also give you a little update on how many tests we have available. I know that we've asked for a number here and I haven't given it just because we don't really want to bring about any worry. We do have 747 tests available right now for community testing. That really puts us in a nice spot to continue to test somewhat liberally, meaning that if you have a fever or two symptoms and no other source of infection, we're going to be screening those people. So with our availability of tests and our allowance in how we can test, particularly in our sick clinic now, our testing numbers continue to be pretty good, and we have enough tests for several weeks at our current rate.
Thank you, Dr. Deere. Looking at our media members for a raised hand, Mr. Bowen.
Hey, so this is the first question I got off of Facebook here. Is it true that only people who've had travel or direct contact with a person with a confirmed case of the coronavirus have been getting tested?
So that's tough because it may have been true a week ago, but it's not true now. And that's where I think we're getting a little bit of difficulty with information because the North Dakota Department of Health, we continue to change the guidelines on who is tested based on the state level. So honestly, if you go on their website, I think there's 5 or 6 different recommendations on who to be tested. And right now it's really quite relaxed, meaning if you have fever or 2 of the following symptoms, which would be cough, shortness of breath, sore throat, chills, or fatigue, and you don't have any other exposure, we are screening you right now. And we're continuing to do our curbside screening. So I just feel that we're doing what's appropriate in our community and our region. And the fact that we don't have a positive is a great thing. But it does bring about questions for our testing, and we recognize that.
Thank you, Josh. Ryan at KNOX.
Follow up for Dr. Deere. Dr. Deere, you told us earlier this week that if you were not tested a week ago, it may be worth your while to call the hotline back again. Is that still the case today?
Yeah, I think if you have ongoing symptoms, and you can always be screened through our coronavirus hotline. So yes, I would say that you can definitely do that. We also have established our sick clinic, like we said, which is located at the Family Medicine Residency Building up by the Ralph Engelstead Arena. So most people know where that is, which is seeing patients on a daily basis now. That started on Wednesday. And we have appropriate care throughout our health system to triage patients into where they need to be seen.
Thank you, Dr. Deere. Looking at the Herald or KNOX, Mr. Joe Bowen, go ahead.
Can people expect any more, say, emergency orders or other policy changes that would have come from any of those listening sessions this week? Beyond curbside pickup and all that?
Sure, understand. I'm going to start this one with potentially, I'm going to start with Mr. Weber on this one, just based on what you're hearing at these listening sessions, if you don't mind. Mr. Weber.
Could you repeat the question quick? I was doing some calculations on how well we're doing at our rate of testing compared to other communities.
No problem, Joe. I'll repeat that. The question is based on what you're hearing at these listening sessions. Do you expect any other executive orders? I went to you, sir, just because you've been sitting in and very much involved with the listening sessions.
Or, not necessarily executive orders for what it's worth, just sort of any sort of changes that might have come from them, regardless of the means by which they happen.
Thank you, Joe. Any sort of means. Did you get that, Brett?
We're taking the issues and concerns that emerged during those listening sessions, trying to push them to the state, our congressional delegation, and to city council. At this time, city council is largely collecting those, prepared to act on them, but waiting to see what resources and come from the state and feds. And also we need to monitor our local finances to make those determinations. Where necessary or possible, we've made very rapid decisions. Under Mayor Brown's leadership, those decisions are already happening. And so that's our main approach to that at this time.
And along those lines, since some of those directives would come from the mayor, Mayor Brown, do you have any comment on that one at all?
Just as problems arise, we'll deal with them.
All right. Thank you, Mayor. Mr. Bowen.
Oh yeah, has there been any discussion or other plans or anything like that to use any legacy fund dollars to help get through the pandemic?
With that one, I'm looking at the panel. Mr. Phelan, please go ahead, unmute yourself and go ahead.
John, this is Todd. Thanks. I think on that question, that as Barry discussed earlier, we've been more focused on our local resources and then also working through the state and the current federal investment package that just got passed today. And I think the legacy fund in that conversation is a further off discussion due to the fact that the North Dakota legislature would have to be in session to further consider that. So we're dealing right now with what we can with immediate resources, knowing that that's a longer term strategy at this point in time.
All right, with that,
go ahead, Ryan. Oh, it looks like Ryan just jumped off. Thank you, Todd. Any other? Mr. Bowen, do you have any other questions? Yes, I see your hand in the air. Go ahead.
Yeah, I have a few here still. What is the Grand Forks County Correctional Center doing to prevent the spread of the coronavirus? And are people still required to report there if, say, they didn't finish their community service hours?
We've sat in meetings. Ms. Deb Swanson, would you like to speak to that one, please?
I can speak to part of that question. The Grand Forks County Correctional Center has taken a lot of steps to limit exposure from the outside. So visiting hours are limited. There are a couple of nurses that are working there that are overseeing all of the infection control practices. I cannot speak to what the courts are doing relative to inmates or what the municipal court or district court is doing. Those would be questions for those respective entities. But I can tell you about what's going on within the correctional center. We consider this to be a vulnerable population because of the way that they are congregated in groups or pods. And so every attempt is being made to screen for illness, testing if it should be indicated, and of course, strict infection control practices. And while I have the floor, I wonder if I could also address the testing issue and the per capita issue in case you are tempted to pull out your calculators and look at other communities in North Dakota. Please keep in mind that Ward County, Burleigh, Morton County, and Cass County all have cases. And when a case occurs, those individuals who have close contact are contacted, and often testing is recommended for them. So you will see higher per capita testing rates in those other communities. We expect that that could happen in Grand Forks as well, but right now we do not have a case, so we're not doing that additional testing on contacts. So I just wanted to make that clarification. And also, it's really important that Altru preserves some of their testing supplies, because that is going to be a really important part of the public health investigation moving forward and protecting our community. Thank you for the opportunity for that additional clarification.
Thank you, Deb. To the jail question, does anyone else would like to put an answer to that for me? Unfortunately, we don't have any representative from law enforcement here working directly with the jail. So I'm sorry, Joe. We'll do the best we can to get back to you on that one. Joe, do you have any other questions, sir?
Yeah. Does anyone expect that unemployment benefits will be delayed due to their increased use?
Boy, I'm looking at my panel here. If anyone would like to raise their hand.
In fact, quite the opposite. Both in Minnesota and North Dakota, there have been moves to expedite those processes. Keith or Barry, could you discuss that?
Well, I can just say that the governor has signed executive orders that do remove some of the barriers so that those benefits can be expedited. So I don't see that to be the case, and they're really focused on that very strongly. I also believe if the $2 trillion Recovery Act, in fact, did pass in something similar to its form that we looked at a day or two ago, there would be enhanced unemployment benefits that would help citizens of North Dakota and the United States. So we also learned that on a business by business basis, these unemployment claims are not going to affect their ratings for individual businesses. The governor signed that executive order, which is extremely important.
Thank you, Keith. Barry, would you have anything to add to that at all?
Ago, we sent out the expedited links for unemployment applications. So that process has been in place already for an entire week.
Okay. Mr. Bowen?
Yeah, hold on. Write down an answer. All right. So the city's made changes to its bus service, the city's area transit, to try and slow the spread of the coronavirus. Going in through the rear entrance of all these buses, at least the ones that have it. Are there any plans to ask or maybe even order private companies such as Uber and Lyft and that sort of thing to do something along those lines?
I'm taking a look at Mayor Brown or City Administrator Todd Phelan. To Mr. Phelan, you have your hand up in the air. Please unmute yourself. Wrong button, Mr. Phelan. You turned the camera off. There you go.
Am I good?
Oh, you turned your camera off, but you're fine. You can still answer. Go ahead.
Hang on.
There you
Hang
go.
on. Hey, we've worked with our city area transit facilities. We have not. We do regulate taxis and other ride services like Uber. We have not moved forward with any regulatory requirements in that area. So that's something that's come up above and beyond what we do for the city of Grand Forks. So we can take that under contemplation.
No current plans then?
No current plans. I suspect they already have plans in place. But obviously ride shares are probably down right now too, but we can certainly follow up regarding that.
Okay, Mr. Bowen.
All right, yeah, this is actually the last one on the list I made for today. And this is another community one. What, if anything, is the city doing to address increased secondhand smoke now that more people are staying home? Someone messaged me and said they live in a condo and their neighbors who smoke are now staying home during the day. And I guess that's making a lot more secondhand smoke go into their unit.
I'm looking at Mrs. Deb Swanson, this one from Public Health.
Well, we have a team that probably can answer this question in the Facebook chat, and so I'll ask them to follow up with that. But there are many condo associations and public housing and apartment buildings that are now tobacco free. So that would include smoking and exposure to secondhand smoke. So we would really like to see all of those entities really enforce this during this period of us asking people to stay home. We know we are asking for sacrifices, and we know that there are some unintended consequences as a result of more people staying in their homes. So yes, of course. We also know that tobacco use greatly increases a person's risk if they should happen to get coronavirus, that it does place them at greater risk for complications. So it's a great time to quit smoking, quit vaping. We have lots of resources at ND Quits to help people do that. And we would absolutely consider this a great time for people to consider that. It's available telephonically, so they don't need to leave home, and they can actually get their prescriptions mailed to them. So it's a wonderful opportunity for people to quit. And I will have our staff post something on either our social media site or the city's with information about that.
Thank you, Deb. And Joe, you said that was your last question, so I muted your mic. So if something pops up, please raise your hand. But I want to say thank you to those of you on the panel for joining us today. And as we do in our meetings and as we do with these press conferences, I look to Mr. Mayor Brown to give us our closing remarks.
Well, I want to thank everyone for participating, and I do agree now as we're looking forward to the future as well. But in the meantime, you need to stay safe, stay social distancing, wash your hands for 20 seconds. I know when I go home, my wife won't let me in the house until we have the soap and water ritual to make sure that you're safely going into your home. So I would encourage everyone to continue to be vigilant, continue to be safe, and we'll see you Monday.
Thank you, Mayor. And as Mayor touched on there, we will be doing these news conferences, and we will be putting them out on Facebook and on